Hi there. My name's Ravi Lescher, and I'm a physical therapist here with the Mindful Back. We all have a lumbar flexion issue. Basically, that means we round our low back far too many times during the day. Whether it's from bending, rounding our back, slumping when sitting, we also just love to constantly bend forward, reach forward. So you see that there are many things during the day that can cause us to round our low back. Well, we've all heard of the proverbial straw that broke the camel's back, right? You can only get away with that for so long. And especially if your outside activities are not keeping your core strength and your abdominals, your low back muscles, and your hips strong enough, then you're going to end up getting back pain from that constant bending. Now, if you already have back pain and you are trying to bend, that's just going to flare it up. If you are reaching, that's going to flare it up. If you are sitting in not ideal positions, slumped, for example, that's going to flare it up. Over time, what happens is that repetitive rounding pulls on the muscles, pulls on the ligaments and tendons that go down either side of the spine and create weakness in that area. And if you go for long enough, what ends up happening is you get what's called a disc bulge. A disc bulge is you're going to get my artwork now. A disc bulge is if you have the vertebrae, which are in the spine, and in the low back, we have 5 of these guys that go all the way in this area in the low back. And say that this is front and this is back. Okay, so your head's facing this way. And this is just your low back portion. We have discs in between each vertebrae that are like jelly-filled donuts is what I like to think about them. They are shock absorbers of the spine, and they're filled with gelatinous material and fluid. So every time you jump, move around, you don't have bones grinding on each other. You have these discs that create shock absorption and fluid movement. But what tends to happen, so this is if in an ideal position you have a neutral spine. And a neutral spine for the low back means that you have a slight arch to it, right? We all have a waist and a slight arch. Some of us are built differently than others. So some of us women have wider hips and we tend to have smaller waists like me, so we have a bigger arch. Other women are a little more up and down, so they have an arch, but it's smaller. But a neutral spine position, you need to maintain that gentle arch so that you are keeping the discs where they belong and keeping the back muscles activated. They like that. That helps them stay strong. Now, if you are constantly rounding your spine, bending forward, sitting slumped, reaching forward by rounding your spine, what happens over time is the back muscles get overstretched and weak. So this is a stretch that's not a good stretch. It's a weak stretch. And you end up getting these discs, these fluid-filled donuts, as I call them. After a time, wherever you're rounding from the most, it's kind of a fulcrum point, you end up getting this disc bulging. So think of it this way. I'm going to draw this here. I hope you can, well, let's do it here. So think of 2 vertebrae, and if you're rounding them, and this is the front and this is the back, the front is coming closer together, the vertebrae. You see that? The back is further apart. This is what happens with rounding. And over time, that disc keeps bulging out further and further and further until it starts creating pain, presses on nerves that go through the spine, that can go to your hip, your leg, your buttock, all the way down to your feet if it's being pinched in the right place and if it's bad enough. So this is why rounding in general is not a good idea for your spine. So we want to try to learn how to maintain a neutral position in daily activities and also with exercise. So for these folks, and a lot of back pain is caused by this bulging disc flexion dynamic. Remember, flexion equals bending. So in this flexion dynamic, something like sit-ups is going to be a big no-no. That is just rounding more, right? And that's going to actually irritate your back pain. So here you are thinking you're doing something good for your core strength, but you're actually irritating your back. And some people will feel the pain during. Some people will feel the pain later. It takes time for inflammation, irritation to build up. With a lot of folks, it can take up to 1 to 2 days sometimes to feel the effects of something that you did. So that makes it a little more challenging to problem solve. But you don't want to be doing anything that is rounding with exercise either. So that brings us to core strengthening with neutral spine position. So if your habit is a lot of rounding, first we have to teach your spine how to maintain that natural arch, neutral spine position in daily activities and also in strengthening. So a very good exercise that is going to be fundamental to moving forward on any core strengthening, any other retraining of your body, is learning how to put more arch into your back when your hips are bent. Why when your hips are bent? Well, when our hips are bent, like with sitting, like with bending, our natural habit when our hips are bent is the rounding. It's different for when we're standing, okay? Standing, walking, tends to put more arch in the back, but we'll get to that later. So when your hips are bent, you want to learn how to put more arch into your back, to train those back muscles how to keep that arch even though your hips are bent. So that brings us to exercise number 1, foundational exercise, which is pelvic tilt.
Hi there. So we are now going to go to pelvic tilting. So for those of you who aren't familiar with pelvic tilting, it is learning how to change the arch in your back. There are going to be situations where you need more arch, like I explained earlier, and there are going to be situations where you need less arch. So I'm going to teach you both directions of the pelvic tilt, okay? First, learning to put more arch in. So if you put your hands on these front hip bones on the sides here, this is the front of your pelvis, and just wrap your hands around this way. So what I want you to think about the pelvic tilt is we're so good, a lot of us, in moving our backs from higher up, right? Where we're sort of arching in our upper back, but the control of the pelvis is not there. In fact, what tends to happen is wherever the legs are going is where the pelvis goes, and that's what pulls on our back. We have no independent control between the core and the pelvis and what happens in the legs and the arms. So I call the arms and the legs kind of the bully of the back. It just pulls the back wherever it wants to go, which is part of what creates back pain. So we want to learn how to separate out and have independent control of the spine, the core, the pelvis. So to do an anterior pelvic tilt, to put more arch into your back, you're going to gently think about rocking your pelvis so that your back is arching more. And I don't know if you can see this. I'm trying to put a light underneath so you can see how this is extreme, but my low back is arching. Do you see that? Notice my shoulders, my head is not lifting. And this movement is coming from the pelvis here. So the way to think about it is your pelvis is rocking. Say these are the front hip bones and you have pelvic bones back in here. You're gently rocking so that these front hip bones are going down towards your feet while arching your low back. It will stick your tummy out too, but that's okay. So it's very gentle, a rocking of the pelvis, front hip bones going down towards your feet to arch the back, the low back. What that does is it tightens and shortens the back muscles, which we want. What we don't want, though, is we don't want to do it so vigorously in the beginning that it actually just flares your symptoms up. A lot of time what happens when you have chronic back pain, the muscles back there have gotten so weakened and inflamed, really, that if you overdo too quickly, contracting the muscle around there, it's what you want overall, but if you do it too quickly, it will flare things up. So we need to proceed cautiously and gently. So what I suggest is when you're doing your pelvic tilt, as soon as you feel tightening in the bad spot, I'll call it, that's where you normally feel your pain, don't go further into the motion. More is not always better here, okay? So you're going to just start from your starting position and then tilt the pelvis gently, feeling those bones go forward, the back arching, until you feel a little tightening in the low back in the bad spot. You'll feel tightening throughout the back, and that's fine. But as soon as you feel an uptick in your bad spot, don't go any further, and then come back to a relaxed position. I like to have people just start with this maybe 5, 10 times, no more than that. And again, in terms of how many repetitions you do when you're first starting, it's about getting the movement to connect with your body and your mind. But if you overdo it, you will flare yourself up. So as soon as you feel like with repetitions, overall, you're starting to notice your back a little bit more in your problem spot, stop there. Okay, you can come back to it again later. You can do this 2, 3, 4 times a day. And in the beginning, you can only get away with a little bit, and that's okay. As you get stronger and your symptoms get better, you'll notice you can do more and more reps without flaring you up. But in the beginning, proceed cautiously and really tune into what your body's telling you, okay? So that is the anterior pelvic tilt. The posterior pelvic tilt, if you have a flexion problem, you need to be super careful with. And that is taking the arch out of the back by flattening the back against the floor. It's really pulling in the stomach muscle. So there's these lower abdominal muscles here. Transversus abdominis is deep muscles that go horizontally here deep. And you want to feel like you're pulling in your tummy muscles towards your spine. So pulling in as you gently tilt your pelvis by pulling in your tummy muscles. You will feel these front hip bones go up towards your head and your back will flatten. Do you see that? I'm going to relax again. Tummy's in, back flattening. Now, 2 ways that are going to be incorrect in doing this is, one, if you over flatten, over round, that ends up actually rounding your low back. And if you have a real flexion problem, a rounding problem, this is going to be an irritant too. So what I tell people is to gently think about going slowly, and as soon as you feel an uptick in your problem spot, I like to think of it as, oh, there it is. It's talking to me a little louder. Notice I'm not saying pain yet. If you listen to it when it's just getting your attention more in your bad spot and don't go further into the motion, just stop there, then you won't irritate it, okay? So again, just starting off with 5 or 10 repetitions, whatever your back says is comfortable for it, just pulling in your tummy muscles, slightly flattening your back, but not flattening it completely if you feel your problem spot more. It's really dialing it down what you pay attention to, the subtle symptoms, because I guarantee you, if you do, 20, 30, 40 repetitions, feeling like you're feeling your back more, but it's not pain, it's just getting your attention more, that's kicking up inflammation, irritation, and later on, your back's going to hurt more. And you're going to say, why is my back hurting? I don't know why it's hurting. It's because you're overdoing. You're not listening to the subtle signals that your back is sending you. So feeling the uptick in the back, and don't go further into it. Go back to releasing, and if your back symptoms go back to your baseline, I call it, which is what the symptoms were that you started off with, then you can go into the motion again, okay? As you do this motion, I want you to also really think of what's driving the motion is the pulling in of the stomach. It's very easy to cheat and push with your feet and your legs to make this movement happen. And in the beginning, just to find the movement, it's okay. But what we really want to be doing is driving this movement through the transverse abdominis, the stomach muscles. So pulling in the stomach to slightly feel this pelvis rotating. Again, it's not a huh, right? You don't want to overdo. You don't want to overforce. That actually will irritate a disc issue if you do that. It's a very gentle drawing in the lower abdominal muscles, sucking in as you very gently roll your pelvis to flatten in the range that is comfortable. And again, if you have a flexion problem, a disc problem, if you over round, you're going to feel it and your back's not going to like that. So make this really gentle. Only 5 to 10 repetitions. And again, you can do this 2-3 times a day. The more you do it in little bouts here and there, not overdoing it at one time, your body will get used to this. This is a foundational exercise that you're going to be using with every other exercise and with the movement patterns that I'm going to be teaching you in the future. So do not skip this step. I want you to get comfortable with the posterior pelvic tilt, flattening your back, tightening your stomach, trying not to push from your legs, and also the anterior pelvic tilt, arching your back, feeling that pelvis rock, just in the comfortable range. You don't want to feel increased pain in your bad spot. You also, if you tend to get sciatica symptoms, you don't want to feel any of those triggered, okay? That can be numbness or tingling somewhere in your back, your buttock, your leg, even down in your foot or your big toe. So you don't want to feel a trigger of increased numbness, tingling, or strange leg symptoms that suddenly start up, okay? After you get in the habit of doing this pelvic tilt both directions and you've learned how to listen to your body so you're not over forcing it and you're listening to what your symptoms are telling you, then the next step is learning how to find your neutral spine position, which is somewhere between those two extremes where you feel the least amount of symptoms in your bad spot in your low back. You're not triggering your sciatica or leg symptoms with numbness, tingling, or pain. You're not feeling your bad spot in your back more. Hopefully you're not feeling it at all, but it's as good as it's going to get for some people. Some people, their pain is always there, but it's where it's the least amount. That is the position that is your neutral spine position. And as you get used to finding that, then we can really start strengthening the core more in that position.
So I hope you found that helpful. If you did, please like this. If you are new to this channel, please follow so you can get more of my videos in the future. I'd also really appreciate it if you would share this video with others that you know. It's my mission to help people with back pain. Too many people suffer in silence and think they just have to live with it. And I'm here to tell you, you don't have to. So if you share it with them, you are doing them a huge favor. Thanks so much, and I'll see you soon.